Evidence webinar, Organizational Intervention for the Prevention of Workplace Stress, Evidence and Implications for Public Health. We'd like to acknowledge our funding and our partners. We've received funding for this webinar series from the Knowledge Translation Canada, which is part of the Canadian Institute of Health Research. A little bit of housekeeping. First off, on the panel, you will see on the right-hand side, you can see the participants that are participating in the webinar. And farther down at the bottom, you should see a window titled Q&A. If you have any questions throughout this webinar, please feel free to post them in the Q&A window. That's where I can see the questions that you're posting, and I'll try to address them as we go through this webinar. Be sure that when you indicate or you select the Q&A window, that you make sure that you send any questions. You just type the questions in the box and press enter, that you send them to all of the participants so that we can all see the questions that are being asked. If you have any connection issues during the webinar, we do recommend that a wired connection is more consistent and reliable than a wireless. But if you have any connection challenges during the webinar, there's a helpline that you can call with a number at the bottom, and they're usually very prompt in providing some support. This is the health evidence team, so under the scientific direction of Maureen Dobbins. We have a managing director, a project manager, several research coordinators and research assistants, and myself, I'm the knowledge broker with Health Evidence. Just a little bit off the top here about Health Evidence, and particularly about our registry of systematic reviews. We search many sources for public health relevant systematic reviews. We apply a number of relevance criteria to ensure that there are interventions that are public health relevant and that they're actually including some outcome information. On the Health Evidence Registry at the moment, there are over 3,000 systematic reviews representing many thousands of single studies. So this is a registry of synthesized evidence on the effectiveness of public health interventions. You can find more information about the registry and about how to use it at www.healthevidence.org. We believe that the systematic reviews themselves and a small subset of summary statements that are on health evidence really will help support evidence-informed decision-making. So a few of the benefits that we understand health evidence to be: saves you time, because we've done all that searching of a number of sources of public health relevant evidence. So very quickly, in usually a minute or two, you can search health evidence in a number of quick and easy ways, and you'll likely find a series of systematic reviews that are relevant to your question. As I said, the evidence or the systematic reviews on health evidence are relevant to public health, and they're as close to current as we can get it. There may be a small lag after things are published by the time we get it quality appraised and up on health evidence. The other real benefit of health evidence is that all the systematic reviews are quality appraised. So you can see which ones are strong, moderate, or weak in terms of their methodology and how much confidence you can have in the review. We apply a transparent process. What we mean by that is that you can see our relevance criteria and our quality criteria, our quality assessment of the systematic reviews, all are available on health evidence. In addition to the registry, there are a number of supports for evidence-informed decision-making available on Health Evidence, and these include things like tools for supporting your searches, tools for tracking your results, and so on. We believe that Health Evidence is really easy to use. This is a model of evidence-informed decision-making that comes from the National Collaborating Center for Methods and Tools. And what we really like about this model is that at the center of it, it indicates that public health expertise is a key factor in evidence-informed decision-making. So as you can see, there are a series of domains of factors that contribute to making a public health evidence-informed decision, including the community health issues in the local context. So what are the health status data in your community on a particular issue or problem? Community and political preferences and actions. So what are the factors that should be considered in any program or policy that come from the political side of things? Public health resources, of course, have to be considered in any decision. And of course, the research. So this is perhaps where we've been less diligent in the last years in bringing the research to the table and considering those factors in making our program and policy decisions. There's more information about this model on the National Collaborating Center for Methods and Tools website. So evidence-informed decision-making, we think of it as a series of steps. So creating a culture of inquiry, of critical thinking, and of evidence-based or evidence-informed practice. So this is the organizational or contextual factors that would support evidence-informed decision-making. The first step, of course, is to ask a clear, focused, and searchable question. So really focusing on what's important in order to find the evidence that is focused on the question. Then, of course, searching for the best available evidence, and we say best available evidence because for some questions, evidence can be sparse. It may be that that particular intervention or that particular policy hasn't yet been rigorously evaluated or consistently evaluated. Or it may be that you do find evidence on a particular question. However, that evidence may be of low quality. So that's why we say we're searching for the best available evidence, and then we critically appraise that evidence so that we understand what we have in front of us and how much confidence we can have in the conclusion. The next step, of course, is to synthesize that evidence. So if you've got a series of systematic reviews, for example, you're going to want to extract the findings from those reviews and then put that all together in an overall summary of the evidence on a particular question, and integrate that with, as I mentioned, expertise, local context, client preferences, and other factors that may be relevant to consider in making that decision. Then, of course, there's implementing and evaluating the programs or policies and determining what happens as a result. So what are the outcomes of the change in practice or policy? And then we suggest that the final step is engaging in knowledge exchange. So sharing the results or experiences of the effects of those programs or policies with others and contributing to the overall evidence base for public health. So the review that we are going to address today is by Bergerman et al., and it's titled The Effectiveness of Organizational Interventions for the Prevention of Workplace Stress. It is a report that includes a very rigorous evidence review as well. So the importance of this review in terms of why it's important to summarize this evidence for public health practitioners is that 1 in 4 Canadian workers describe their daily lives as highly stressful. So this importance of the review is taken right from the introduction of the review. There's a high level of workplace stress results in loss of productivity through absenteeism, reduced work output, and increased disability claims. And 3 in 4 short-term disability claims in Canada are related to mental health problems. So this puts the focus of this review in the context and indicates why the results are needed and how they might be applied. So now we come to our first poll question, number 1. We'd like to know among our participants, who has heard of PICO? So I think you should see a polling question on your desktop. And you can just indicate, select A for yes and B for no to indicate whether you have heard of PICO before. Great. Well, thank you for participating in that polling question. So out of 8 attendees, 50% of you have heard of PICO before, and 12% have not heard of PICO before, and 3 did not provide an answer. Thank you for that. We'll move on now. So one of the things that we think about when we think about this PICO framework is it's a way, a heuristic really, a way to formulate a searchable question on a practice issue. So P stands for population or situation. Intervention, or I stands for intervention or exposure. That will sometimes be an E. C stands for comparison. And O stands for outcome. Sometimes you also want to indicate the setting that you're interested in formulating a PICO question. So the objective of the Bergerman systematic review was to evaluate the effectiveness of organizational level interventions for the prevention of occupational stress in terms of reducing stress, psychological symptoms, absenteeism, presenteeism, and turnover. So the P, or population of interest, was employed adults. Organizational level interventions included job redesign or restructuring, participation and autonomy type interventions, training and education, co-worker support groups, physical and environmental characteristics, communication, and role issues. So those are the types of interventions that the authors of the systematic review were interested in. The comparison was to some other intervention or no intervention, and the outcomes measured were stress, burnout, psychological well-being, sickness or absenteeism, and turnover or retention. I should indicate that the authors were also interested in presenteeism, but did not find any studies that had assessed interventions on presenteeism. So their PICO question was, what is the effectiveness of organizational level intervention for the prevention of occupational stress on those outcomes among employed adults? So overall conclusion, I just want to make a note that I'm increasing the volume of my microphone, and hopefully that will clear up any sound issues. Overall considerations from this systematic review. This is a methodologically strong review that includes 6 systematic reviews. So this might be referred to as an overview or a review of reviews. So this includes 105 primary studies. So this is a very large body of evidence. 6 systematic reviews in terms of quality. There was 1 systematic review of high quality, 4 were moderate, and 1 was low quality. And there was moderate to low quality among the primary studies in these reviews. The overall conclusion of this review was that no firm conclusion can be drawn about the most effective type of intervention or strategy. So what the authors found was in these systematic reviews, there were so many different populations studied, so many different interventions implemented, and many different types of outcomes measured. And so it was very difficult for the authors to summarize this evidence in terms of putting it all together and saying, well, we found 12 or 15 studies that looked at a particular type of intervention to see if it reduced burnout or to see if it reduced absenteeism. There was such variability among the primary studies that the best the authors could do is just describe the interventions, tell us about the quality of the studies that assessed those interventions, and report back the findings. So what we've done in terms of summarizing this very large technical review is provide the data for the effective interventions in the high-quality studies. So I'll go on now to discuss what the outcomes were in the review. So there were a number of interventions that aimed to reduce stress in the workplace, and those were found in 2 systematic reviews. There were 11 different interventions assessed in 37 studies. So a particular policy intervention, for example, that was aimed to reduce stress might have been studied in different ways across 37 studies. There were a number of interventions aimed at reducing burnout. 6 systematic reviews found studies that were addressing burnout, and there were 10 interventions assessed in 105 studies. There were a number of interventions that aimed to improve psychological well-being. These were found in 5 systematic reviews. There were 28 interventions assessed in 95 studies. The next outcome was absence and absenteeism. There were 2 systematic reviews that found 11 interventions that were assessed in 76 studies. And then there were a number of interventions aimed at reducing turnover. So these were found in 2 systematic reviews. 4 kinds of interventions were assessed in 39 studies. So what's the evidence? So the first outcome, reducing stress, as I said, what we've indicated here is the studies that found an effect, that actually found some change as a result of the intervention in the high-quality studies only. So normally that was what we would consider that would be useful to practitioners in decision-making. So the first, the other thing I want to say is in this point number 1, training and education with theory, role-playing, and experiential exchanges, and in brackets, TRA. The authors of this systematic review used a kind of a categorizing system for the interventions. So in the previous slide, where you see the interventions aimed at reducing absence and absenteeism, you see 11 interventions were assessed in 76 studies. So those 11 interventions might have been slightly different, but they would have fit into the category, a particular category that the authors applied. So in this case, this particular intervention fit into a training category. So you'll see a number of these acronyms throughout, and I'll try to describe them. The review has a very nice table of the types of interventions across the studies, and that's helpful in in terms of understanding exactly what the characteristics of the interventions were. So in point number 1, a training and education intervention that included theory, role-playing, and experiential exchanges in one high-quality study had a moderate to small effect on stress immediately following the intervention. So there you can see the mean difference of 0.34 with a 95% confidence interval, excuse me, from 0.62 to 0.6. So that's where we say that there was a moderate to small effect. So at the far right end of the confidence interval, that was a very small effect on stress following the intervention. And at the far left end of the confidence interval, there was a moderate effect on stress as a result of the intervention. So the thing to ask yourself is, if we employed that intervention, would the result at the far right, that is the negative 0.06, or a small effect on stress, be worthwhile in terms of would you want to implement the intervention? However, they also report that there was no effect at 6 months follow-up. So there you can see that the mean difference between the intervention and control group was 0.19, but the confidence interval goes from negative 0.49 to positive 0.11. In other words, the confidence interval crosses the line of no effect, so we cannot be sure that the intervention would have any effect at all. So the second intervention was action teams with management and employees to improve team communication, cohesiveness, work scheduling, conflict resolution, and recognition of good work. So that intervention was classified as PAR-COM-JRD. And I'm just looking to find the schema that describes these. So PAR, for example, is participation and autonomy, COM is communication, and JRD is job restructuring or redesign. So that is the category that this particular intervention fit into. So that's helpful for decision makers to know exactly what were the elements that were part of this intervention. So again, this intervention was assessed in one good quality study, and this intervention was effective compared to no intervention, and at a P level of 0.02. At the bottom, we've listed the interventions for which no impact was found. So this is useful perhaps to understand which interventions have not shown to be effective. So there were 2 job redesign or restructuring interventions, 2 co-worker support groups with education and training, job redesign or restructuring with education and training, and with education, 2 co-worker support groups, and a participation and autonomy with training and education. So if it's helpful for you, there are characteristics of all of these interventions in the appendices of this technical report, so you can see exactly what the interventions were that were found not to be effective. So there were a series of studies that looked at reducing burnout as well. So a participatory intervention to identify psychological stressors and solutions, again, in only one high-quality study, had a large to small effect on work-related burnout compared to a control group. So there you can see the difference was -1.83, and the confidence interval goes from that large effect on the left side to a small effect on the right side of the confidence interval at -0.09. I'm just going to check the Q&A to see if any questions have been posted, and I don't see any so far. The second point is that a job redesign or restructuring with coworker support groups and with communication interventions. There were 4, I think that might be moderate quality systematic reviews plus 1 single study. This produced inconsistent results. In other words, in some cases it worked and in some cases it didn't work. So we can't say conclusively that that combination of elements of intervention would be effective, but in some instances that an effect was found. So it could be worthwhile looking into those interventions to see which ones worked and perhaps considering why they worked, how they were implemented, and why they worked. There was no impact for the following interventions: job redesign or restructuring with communication and coworker support groups, and for 2, job redesign or restructuring with education and training. So in this review, the studies that looked at those interventions did not find an effect on reducing burnout. Pardon me. So in terms of the studies that looked at improving psychological well-being in the workplace, a participatory stress reduction committee, more and smaller teams with sub-supervisors, more on-the-job training and ergonomic improvements in 1 high-quality study that was found in 2 different systematic reviews, significantly improved mean depression scores in the short term. So there you see the numbers, the pre and post measurement of depression. And in the control group, you can see that there was, at post, not only not a reduction in the depression score, but a small increase there. So that particular intervention had an effect or improved the depression scores in the short term. In the second point, control over production transferred to employee work groups, along with a steering group of representatives responsible for overseeing the change in 1 good quality study was found to be effective. In a third example, a participative action research intervention in 1 good quality study significantly improved mental health, and flexible working hours, again in 1 good quality study, significantly improved mental health compared to control at the significance level of 0.05. And then at the bottom there was no impact for the following groups of interventions. So for example, an intervention that included coworker support groups, training and education, participation and autonomy, communication, and dealing with role issues, no impact from that intervention on psychological well-being, and so on. So the evidence that aim to the evidence for the interventions that aim to reduce absence and absenteeism, a participatory stress reduction intervention, again, 1 high-quality study, significantly reduced absenteeism compared to control. And in the second point, an intervention that included more teamwork, more personnel, role clarification, production goals, fewer supervisors, a change in shifts, increased feedback, and a new vending machine and microwave. This significantly reduced sick leave, again, in 1 high-quality study. A third type of intervention was a participative action research intervention in 1 high-quality study significantly reduced absenteeism compared to control group. And there was no impact for a job redesign restructuring, job redesign restructuring with education and training and participation and autonomy, or job redesign restructuring alone. No impact of those interventions on absence and absenteeism. In terms of reducing turnover, the authors did not find any studies where the interventions were effective in reducing turnover. And they did find that there was no impact of change to a primary care nursing model with support from managers, advice on core skills, and promotion of effective interprofessional communication had no impact on reducing turnover. And I did say a little bit earlier that the authors aimed to summarize the evidence for the effect of interventions that aim to reduce presenteeism, but did not find any studies that assessed interventions on presenteeism. So the general implications from this review included a large body of evidence, so 6 systematic reviews of 105 studies. Unfortunately, there were many of the studies included in this review, the primary studies, that were of low quality. So you have seen that what we've presented here on the various outcomes, where they did find a positive effect, it was one study would find it here, one study would find it there. So we can only conclude from that, what the authors have said is that no firm conclusions can be drawn about the types of interventions that we could have confidence in that would make a change on those outcomes. So their conclusion and the implications of this evidence is that workplace stress reduction interventions should be rigorously evaluated and that we need to build this body of evidence. That research should continue to assess the effectiveness and potential harms of workplace interventions, and in order to determine the interventions or strategies that are effective in particular settings. So now we're going to move to poll questions number 2 and 3. And I think you will very soon see these poll questions. So the first question is, did you find the information presented today helpful? And we'd appreciate it if you would take just a moment and respond to that question. So select A if you found the information helpful, and B for no if you did not find it helpful. Thank you for participating in that. So about a little less than half participated, and the good news is that everybody found the information. Everybody who participated found the information helpful. So thank you for responding to that question. It really helps us to think about how we can be helpful in terms of organizing these webinars and making this information helpful to you. The second question on the poll is, was the information new to you? So we'd like to understand whether this was already understood by you or this contributes to some new knowledge for you. So thank you for taking the time to answer that question. Again, maybe a little more than half participated this time. And of the participants, little more than half found that this information was new, and a few people found that it was not new. So thank you for participating in that. At this time, we'd like to ask if there are any questions from the participants. If there's anything about the review itself or how the review was conducted, what the evidence that was included, how the outcomes were measured, If there are any questions at all, as I said before, under the Q&A on the right-hand side, you can type a question in there and just hit enter, and we'll do our best to address any questions. And while I give you the opportunity to post any questions, I'll indicate, okay, so maybe I'll just address this question that came up. You mentioned at the end, the question is, you mentioned at the end of the presentation that one of the recommendations is about harms of workplace interventions. Can you tell me about findings of harm? So that's a great question. So I'm just going to back up a little bit here. I believe that this refers to the general implications that the review suggests. So when a systematic review of evidence is done, at the end, the authors draw some conclusions about the body of evidence and the state of the body of evidence and make suggestions about next steps for research. That's why in a systematic review, you most often see more research should address. That could be particular populations, or more research should look at these types of interventions, or more research should assess those interventions on a particular outcome. What the authors found in this review was that the interventions looked at reducing stress, reducing turnover, reducing burnout, and improving psychological well-being. But interventions can sometimes cause harm, and I think we saw in one of them that the result actually increased stress among employees. We saw in one outcome. So the authors here are suggesting that rigorous evaluations of workplace stress reduction interventions should not only assess positive outcomes, but also see if any harm is done on those outcomes. So I wouldn't mind if you just indicated whether that addressed your question or whether you have a follow-up question to that. The only other thing I will say is that this review summarizes the existing evidence, and the authors found that the primary studies included in this review did not look at whether there was any harm. So that was not what they measured. They just measured, was depression reduced, or was turnover reduced, or was absenteeism reduced, but they didn't look at whether the intervention actually caused more stress among employees. So thank you for that. The next question I have up here is, are you aware of the types of tools that people are using to measure workplace stress? That's a really excellent question. The review does describe in detail the tools that were used, the sort of, for example, the depression score, the psychological well-being test, and there's a paragraph in the technical report that describes in detail and lists all of the different tools that measure the outcomes in this review. So I would draw your attention, if you're able to get a hold of the review, to that paragraph to have a look at the different tools that were used in the included studies. And I see somebody is typing a question, so I'll just wait a moment. Oh, and what the posting there is that these comments did manage to somewhat apparently answer the question, so thank you for that. So please feel free to post any other questions you have in the Q&A window. At the end of this webinar, once you close the WebEx window, you'll be directed to an online evaluation. It's just a little pop-up evaluation. It takes maximum of 10 minutes, and we'd very much appreciate your contributing to our evaluation of how well this type of presentation of evidence works for you. So that would be very, very helpful to us in understanding how we can best translate the findings of systematic reviews out to decision makers and practitioners. So if there are no other questions, I'll thank you for your participation today, your excellent questions, and invite you to contact us with any further questions at info@healthevidence.org. And note that our presentation will be up on our board. If you log in with your Health Evidence username and password, or register if you aren't yet a member, you'll have access to the presentation. And again, please do feel free to contact us with any further questions. Thanks to all, and I'm just going to check the Q&A window one more time to see if I have any further questions. And I don't see any there. Thank you all very much for your attention and your participation, and I'll close the webinar.